I'm Betsy Rigby, Associate Vice President at BWF. We are a fundraising consulting firm based in Minneapolis. We have clients from Australia, across the country, and over to England. Our consultants are across the country. We provide services, consulting services in all facets of fundraising, from campaign counsel to digital engagement to systems and operations, communications, the whole thing. We've been a firm for 40 years. Maybe some of you may recognize the name Benz Whaley Flessner. We rebranded last year as BWF. Over the course of our past 20 years or so, the firm has been pleased to conduct an almost annual survey of healthcare donors and to provide this as our contribution to the field, hoping that it serves as a robust, ongoing tool for fundraisers to get a snapshot of the healthcare donor community. Healthcare being defined and inclusive of obviously hospitals, community hospitals, academic medical centers and research centers, children's hospitals, and long-term care facilities. 2020, of course, was a year like no other. Definitely mixed news. Overall giving, according to Giving USA's recent numbers, increased 5.1%, 2019 to 2020. Healthcare saw a decrease of 3%, and yet healthcare is still reported to be the third top cause among ultra high net worth individuals who make charitable contributions. 61% of these individuals indicate that they give to healthcare. Healthcare institutions received at least 13 gifts of $50 million or more in 2020, and there were more than 150 gifts greater than $1 million to healthcare organizations last year. So with a year like no other, we knew we needed a survey like no other. And I was pleased to consult and speak with a number of colleagues, including Bill, as well as others, Bruce Bartu, Cheryl Hadaway, Mark Costigan, Jimmy Martello, Randy Varju, who helped inform the content of this year's survey. We also received feedback from a number of other institutions. So this survey, though based on our previous surveys, really we wanted to make sure we adapted it to acknowledge the new questions we were all asking about giving to healthcare this past year. This survey was distributed to affluent households with incomes of greater than $150,000 who support healthcare. A majority of the respondents, about 61%, self-reported a net worth of $500,000 or more. We saw a fairly typical age distribution among the respondents. We had replies from all 50 states. The largest segment was from California. The survey was distributed in March of this year, an important moment in our the history of the pandemic. In addition to the individuals I just mentioned, we also made the survey available to colleagues from these institutions to include some of their major donors. And Bill and Sharp took us up on that offer. So I will allow Bill to introduce himself.
Thank you, Betsy, and good, actually morning for me, but good afternoon for everyone else, I guess. Again, I'm Bill Littlejohn, and I have the honor of serving as the Senior Officer for Philanthropy here at Sharp Healthcare in San Diego, where I'm in my office today, which is great to be back in the office and having in-person meetings. I've been the CEO, Senior Vice President for now 19 years. And if you include my time, I was, like Betsy, a consultant before that. It's about 23 years at Sharp. And again, I'm going to put a plug in several times for tenure. I think you'll, from what I'll be able to share today, the incredible importance of being around an organization for an extended period of time in terms of donor development and relationships, especially in 2020. And so that's quite important. I've been heavily involved in healthcare philanthropy now for 30 years. I've been very active in the Association for Healthcare Philanthropy, where I served as the chair of the board, and still very active in the mentor program and conferences and presentations. I am a strong believer of best practice sharing and strategic philanthropy development. And we do that by sharing with others, learning from each other like today, and being part really of a network of professionals focused on the unique dynamics of philanthropy and healthcare, which again, you'll see today from the survey and the discussion that we'll have. So I'm delighted to be part of this. We were delighted to be part of the survey. We shared some of that with our board at our last meeting. I think they found it very informative. So thanks, Betsy, again, and look forward to the session.
And Bill, I don't remember when we first met. I've known Bill over many years, and I can say that in every conversation I have ever had with Bill, I have always learned something. He certainly epitomizes that ideal of sharing information and knowledge for the betterment of the field. And so I couldn't think of a better partner as BWF tries to do the same with this survey. So I couldn't be more grateful for Bill joining me today. I want to present the data and build the context. So our firm believes heavily in data, the power of data, and yet at the same time always believes that there's a context for that data. So again, Bill, thank you for joining me. Our agenda today is pretty straightforward. We're going to go through the numbers in 3 different categories. We're going to look at overall giving results from the survey, then the questions that were specific to the impact of the pandemic on donors giving, and then we have a couple of data points about health equity. We will then, because we couldn't possibly miss the opportunity to create more data, take advantage of your participation. I have about a dozen quick questions to ask all of you by polls to see how much your experience as fundraisers, as fundraising professionals aligns with what these donors reported earlier this year. And then hope to have time at the end for Q&A. Given the size of the group, I would ask that you use the feature in Zoom at the bottom of your screen in the control bar, the Q&A function, and ask that as we go along, you put your questions there. I have a colleague keeping an eye if there's something specific to the topic, like you need clarity in order on the slide or the data point. We want to answer those in real time. Larger, more general questions we'll save for that time at the end, just so you're clear on how we intend to proceed. So with that, let's jump right into what we saw from the respondents to our survey. We asked them to go through the questions thinking about the one healthcare institution that they give to most frequently and support most generously. So we appreciate donors may have a number of healthcare institutions that they support, but as they answered, we asked them to think about the one that they support most frequently, most generously. And then we asked what kind of institution that organization is. And about a third of our respondents to this year's survey indicated that they support a children's hospital as their top healthcare recipient of their philanthropy. That has been consistent from other surveys we've conducted. What was a little new this year was to see an increase in the numbers reporting that their top recipient are academic medical centers and healthcare systems. Having spent about 17 years in a healthcare system with academic medical centers in it, I wonder if part of that is in small part perhaps a reflection of donors having a better understanding of what an academic medical center is and whether or not it's part of the healthcare system, and maybe if we're doing a better job at helping make that distinction. You'll see the distribution of the other responses. In the other category, when asked to then clarify, there were responses that indicated respondents were we're answering this question about a cancer-specific organization. Other respondents indicated they supported a healthcare research organization, and hospice was also mentioned. So I'm always curious what's included when you see an other at the bottom. So I just wanted to offer that was some of the feedback when we asked the respondents to indicate what organization they support primarily with their healthcare philanthropy. So that's,
Betsy,
yes.
not to interrupt, we do have a couple of quick questions. The first for clarification, the first being, were health cause organizations like the Alzheimer's Association, MS Society, American Cancer Society, etc., included in this survey?
So it's not that we went to the the majority of the respondents were identified as high net worth individuals who support healthcare. We weren't going to individual organizations to their donors. So donors could indicate that those types of organizations were their top recipient of their healthcare philanthropy. There were, when we had choices like this, these were the choices. So they could always include that under other, and there were no, otherwise we weren't asking an academic medical center question or an assisted living center question, but they indicated what they were answering about. I hope that's helpful clarity. Thank you for jumping in with that. It's important to clarify. That's kind of the basis of the whole survey. So I'm glad we were able to clarify that. As with other surveys in the past, our respondents report supporting other types of organizations in addition to their support of healthcare. Education often ranks second, and environment and animals also often ranks third. So this was a fairly consistent report from previous surveys. We didn't see significant changes. It is important for us to always be mindful that our donors are likely generous to other types of organizations. As a fundraiser in my day and now as a consultant, I often like to ask donors when they're thinking about a specific organization, where it ranks in their giving to other organizations. So I always hoped to hear that the organization I represented was within their top 3 priorities. And if it wasn't, then I would often ask, how could we? Is there anything we could do to become one of your top 3 recipients?
And we need to celebrate this. This is a really very important point, Betsy, that philanthropy begets philanthropy, and gifts beget gifts. And we need to celebrate the other causes and the other gifts that our donors make, and encourage that and share their stories. And that it only goes to the aspect that, you know, people make personal decisions about philanthropy because of causes they support, and never get into the idea that we're the only one that can be on the horizon for them. Now, certainly there are people are very much their priority is healthcare, but it's important to understand that many have many priorities, or at least several, and to make sure we celebrate their giving and being a philanthropist.
When we ask them yes.
Forgive me for jumping in again, but there was a quick question. Was there a trend where states, cities, these high net donors gave?
So we know where the respondents answered from. We don't necessarily know where they were giving to by geography. When we ask them to name the organization they support, sometimes we got a specific name, and we can, if we don't know, we could look it up. Unfortunately, sometimes others said a research institution or a hospice, and we didn't have the name. So we were not able to consistently slice the responses by where they give to. We can look at where the donors are giving from, if that's helpful. That's not a slice that's in this deck. So we also asked donors what kind of support they provided to their healthcare institution, and unrestricted dollars were reported as given most frequently, capital coming in second, pandemic related funds third, endowment was fourth, and other came in as it usually does at the end. Again, looking into other, the respondents reported that includes cash, gifts in kind, payroll deduction, and their volunteer time. We looked a little bit deeper into the unrestricted giving by type of institution, and saw that of the types of institutions mentioned, so of these types of institutions, children's hospitals saw the most support of unrestricted dollars. One variable, of course, is how much research a children's hospital does. We would expect to see the more research a children's hospital does, probably the lower the unrestricted funds it receives, and vice versa. So those children's hospitals receiving more unrestricted funds are probably those hospitals not conducting significant research. Behind children's hospitals, we saw the other facilities most often received unrestricted support, 37%. And again, I think in part because, as we noted, that other included organizations like a cancer specific healthcare institution, a research institution. In a way, the institution itself already has a focus. And then community hospitals and healthcare systems received an equal amount of unrestricted funds, tying for third, as we split what types of organizations received these types of funds.
I'll just say on this one, this is really important. Unrestricted gifts are the gifts of trust. They trust the management, the leadership, the organization to do the right thing with the money. And they believe it will be well spent and allocated to strategic priorities. And that comes, I think, from what you'll see in terms of donor development and relationships. Now, ultimately, those unrestricted money goes someplace and ends up being in a restriction and can demonstrate impact. But I think this is really important, and we saw this in the pandemic as well, that pandemic-related funds might have been sort of for the pandemic response, like for us, but they were pretty much unrestricted as well, and they allowed us to put it toward priorities. And this came from, and I think unrestricted giving comes from trust, it comes from great communication, donor development over time that allows you to share the kind of institutional message of the power and of philanthropy and its investment sort of power. And therefore, donors say, yes, I can give you $1 million because I know it's going to go for these strategic priorities. It's not sort of purely unrestricted, but it begins that way. So this is a really important element. And I think to look at and to say, one, it's congratulations to those who can do that, but also something to aspire to.
And I'll note, in a recent feasibility study conducting almost 100 interviews with donors, one of our questions was, when you consider a gift to this institution, is one of your first filters whether you're being asked for a capital gift, an endowment gift, unrestricted? And the most frequent response was, I want to hear where I'm going to have the greatest impact. And I want the organization, to Bill's point about trust, to tell me what kind of bucket it goes in to have the greatest impact and what they need the most. I trust the organization to tell me where they need the money. I'm not necessarily looking for a specific bucket first. And just as we move forward, again, because of the number of participants, if you do have a question, please put it in the Q&A function. I do have a colleague who's monitoring that and responding because I couldn't possibly do both. So you will get attention, and we will try to have general questions answered at the end of the session. So we do want to be responsive and manage the group.
There is one quick clarification detail. I apologize if this was covered before, but just for re-emphasis for those who missed it, how big was the sample size of this survey? And what was the giving level net worth of those surveys? Just once more.
So the survey was distributed to individuals with a net worth of $150,000 or more. A majority of respondents, 61%, self-reported a net worth of $500,000. And we have responses, over 700 responses are included. We received more, but did not, but in going through the responses did not include all of them in this. So this is at least just over 700 responses, and then Bill's donors are included in the responses. So we asked our donors who influences their giving decisions, and as has been reported in previous surveys, the spouse or partner is reported as the individual who has the greatest influence on a donor's philanthropic decision. In the survey, we also asked about who influenced their first gift to their healthcare institution. That also reflected the patient experience, including of a family member or friend, was the top influence of making their first gift to their healthcare institution. The second was the reputation of the organization. The third was being asked by a representative of the organization for the first gift. And then we also asked about those who influence them in considering increasing their support to their healthcare institution. And the results were very similar, so that we see the spouse, partner, other family members having a strong influence on a donor's philanthropic decisions. So as fundraisers, we of course are well advised to be inclusive of those individuals, to know our donors well enough to know who they would like to include, and make sure that we do include those others when they should be.
Healthcare is a family dynamic, especially in hospitals and in all types of healthcare, that family members have experiences over long periods of time and different dynamics. And we do very much to involve family members, especially spouses, in almost all of our cultivation and solicitation activities, just because the fact that they are in the SHARP network, they're in the network of our healthcare organization. And so it's one family member might have had the life-changing experience, but other family members were part of that as well. So that's a really good point, Betsy.
Of course, we're interested in those who are influenced by representatives of the organization. We hope that's us, as well as our clinical partners. So we asked, what are the most important qualities of the representative of the organization? Knowledge of the organization was clearly the most important quality that these donors considered, but knowing them and their circumstances is also important. Expertise with setting up gift plans, longevity of the relationship, to the point that Bill made previously, is also important. And in this case, most of the others, they checked that because it wasn't applicable. They reported that they weren't working with an individual representing the organization. And this was especially true for donors to SHARP Healthcare.
Yeah, I'll make a point about that, I kind of tell people I work in healthcare at SHARP first and in philanthropy second. And my knowledge of the organization, its people, its vision, its strategy, its politics, whatever it might be, is incredibly important, since I end up doing much of sort of the communication and cultivation. Others are highly involved in those allies. But at the end of the day, and that's why also tenure is important, is the end of the day that I work for Sharp Healthcare. I'm the facilitator of philanthropy, but this is the organization that people give to. And so it's really incumbent upon all of us to become good students of our organization, its people, its culture, its dynamic. I'm the resident historian at Sharp because the legacy of Sharp has lots of philanthropy tied to it. And for a person like myself to articulate that to others is incredibly valuable. We're doing that right now and saying, you know, you can be part of the legacy that got started 75 years ago. And I can share with you a story about a donor, and that can inspire them. So, and the aspect, same thing, that it's not just about making $1 million gift, it's about how you can make $1 million gift and what it can, and how we can create the win-win. So in the end of the day, we as professionals, not just having fundraising knowledge, have institutional knowledge, history, and dynamic that creates that maximum solicitation dynamic. So be a student of the industry and be a student of the organization, and you'll never stop learning that as well. And I think that's really an important characteristic to have. And it's really helped us with that. And again, people, heck, 3/4 of our board meetings that we have is all educational. It's educating our board. It's sharing inspired stories. It's not sort of going through tab A, B, or C. It's about this incredible organization and how board members, the more they know, the better they can be in their roles.
We asked a number of questions about stewardship. So it's not, of course, just about the solicitation for support of philanthropic priorities, but the work of stewarding, and asked the survey participants how well informed they feel about the organization they support. And happy to see that they, in general, feel that they are well informed about their healthcare institution. We also asked questions about whether or not they expect special recognition as donors to a healthcare institution. And this was a little bit of a surprise this year, in that a significant majority, 68%, I'm sorry, that this year 31% said that they did not expect any kind of special recognition. The 68% last year did. And so we saw a decline in the expectation of special recognition, special services for being a donor. So I think it's important that we always think of, take the opportunity to ask our donors how they want to be recognized. There may be some change in expectation of special amenities as a donor. And of course, Bill's donors felt particularly well informed.
Well, and that another point that we have made stewardship a strategic priority. We actually have a standing committee of the board for stewardship, and a chair sits on the executive committee. We have an extensive plan. It's not just thanking donors. It is communicating, it's cultivating all of that together in the dynamic of stewardship, again, about the institution, about the impact of their gift, about the value of what they do. And especially now, in the pandemic taught us, is we doubled down, tripled down on that stewardship communication to be well informed about the institution, about our fight against COVID, about what was happening, about what they needed to know in the community. You know, the hospital became sort of ground zero. And again, our communication efforts and building that. I mean, we raised a lot of funds in COVID because it was COVID, because what we had done over time to create a stewardship and communication and engagement information plan that was reaching and touching multiple times our donors and friends, and we appreciate the fact that they feel well informed. What does that turn to? Unrestricted gifts. Long-term relationships, because we retain that informational relationship in a very extensive way. And I think that's going to be the next normal, is not just the traditional once a month newsletter. It's going to be much more personalized, electronic, multi-platform, you know, whether it's in Zoom or anything else, of and not just sort of asking, but engaging in moves management in a number of different platforms to make sure that that still is strongly agreed that they are well informed.
There is, Bill and Betsy, there is a quick question for clarification. The attendee mentions you said there was a change this year. 31% did not want special recognition this year.
Oh.
Was that the number last year?
So I apologize. Perhaps I misspoke. When asked if they expected special recognition, in the last survey, 68% of the respondents said, yes, I do expect special recognition. 31% in this survey said, I do expect special recognition. So there's a significant change, a significant decrease. 68% last year, 31% this year saying, yes, I expect special recognition. So I apologize for confusing those figures.
It's a good point. And for us, it was not about special recognition. It was about information. It was about, keeping people informed. They didn't, support COVID. I don't need to get a plaque for my gift to COVID-19. I need to know that, we're winning the fight together. So that's a good, and we'll see how that evolves in terms of going forward, in terms of how communities perceive the relationship with their healthcare institutions in the future. I mentioned this, is that for the first time in history, all hospitals became the same in the United States. People did not travel for COVID. They weren't sent someplace, to a specialty hospital. It was their community hospital, whether they had an ICU, whether they had great people, whether they had a ventilator, whether they had nurses and doctors to take care of them. That was a whole new perception people had about how valuable our local, and whether it was a hospital or a specialty place or a children, whatever it was. And now could there be a new dynamic of appreciation and relationship with communities in terms of the value of the healthcare enterprise, whether it's a system, a community hospital, whatever it is, it's such an invaluable part of a community and therefore worthy of philanthropic investment versus it's a big, confusing, expensive place that people don't quite understand how it all works. So huge opportunity here with that.
And so speaking of, in this universe of respondents to this survey, 57% indicated that they had made a donation in support of some kind of COVID-19 relief effort to their healthcare institution. And to the points that Bill has been making, I think this is an indication of the strength of our relationships with our donors, that a majority could respond positively to meet an emerging need and trust that their institution would respond to the crisis. There wasn't necessarily a lot of time to cultivate. There was a lot of here's our need and a lot of response to it. Again, to Bill's point of having these trusting relationships with our donors.
That's a great point. I should say that we pivoted like everyone else had to. And of course, we're a hospital system that was dealing with COVID, but we worked together with our marketing and digital strategies people and came up with an actual marketing campaign, including television. And it wasn't just about giving. It was about, we're at the center of the fight against COVID. It's our time of need is here and you can help us. And the community just absolutely responded. We got more hits to our website. We got responses. We had thousands of new donors. We had in-kind contributions because we did it. We went out and asked and we communicated that back to communication. And we also had the trust of the community, but we also talked about sharp in the fight against COVID, not just the foundations asking for money. So, and that sort of brought us a new dynamic as well about the power and using multi-platform communication. We're designing our big campaign right now, and we know it's going to be on multiple platforms, not just in person. So that, and again, the aspect of you don't get unless you ask, but if you do it effectively, you can do well. So there were quite a lot of lessons that came out of that. And I'm happy to share if people want to follow up with me later on of all of what we learned in this last year.
Bill, there is a quick question specifically for SHARP. Did SHARP see an increase in new donors giving to COVID relief?
Yes, we had, well, this whole big campaign we did, we ended up with like 5 million impressions across social media, television. We did 1 million emails. We had 4,000 donors to COVID in about 2.5 months, $6 million, including $1 million of in-kind contributions. And about 40% of those donors were new. They may have been in the SHARP network as patients or others, but they were new donors to us. Now, the big objective for us is, can we retain those? And that goes to communication, stewardship. And here we are basically a year after our peak of fundraising. Our peak of fundraising was in April, May, and June of last year. So now we're in this, talk about data, Betsy, really valuable analysis of all of those donors' contributions, where they gave, and now can we now work to retain those relationships, especially the new ones, and move them to a giving dynamic around SHARP strategies and priorities and long-term relationships. So we have a huge opportunity. It's somewhat of an unknown, but yes, we had a big uptick in new donors, and we had a big uptick in stronger relationships with those who were donors. So, but we have a big task ahead to work to retain that. Great question.
So we asked if the pandemic had had an impact, a change to their giving. 42% of our respondents said that their giving remained the same. We saw 33% indicated that their giving increased because of the pandemic, and 24% said it had actually decreased, which I think helps underscore perhaps the disparate economic impact that the pandemic has had, that some simply didn't have the funds that they may have had in the past to make gifts, or they felt a sense of insecurity about making any significant gifts at this time. So at SHARP, they reported their giving remained the same.
Yeah, and that's true. We got new donors, but our giving, and that was great. And actually, we had a donor who had made a $5 million pledge for a heart center. And we actually went to that donor and said, would you mind extending your pledge by 1 year and making this year's pledge payment be for COVID? And he said yes. And we got $1 million for COVID, and we're still going to get the $5 million for the heart center. And there see this question about unrestricted cash, and that, of course, we had the COVID fund that was for COVID activities, but it started out, we had no case for it. This was the importance of your institutional knowledge and working together to develop. We've funded research and nurse training, and obviously PPE and disinfecting robots, you name it, we helped pay for it. We've now gone back to all of our donors to tell them all the impact that we've done, and we hope that that can be retained and they can appreciate SHARP's overall fight in the battle against COVID, and therefore philanthropy had good everywhere. It doesn't matter what you gave, you helped provide for this or this or this. We came out of it, we're better, and now we're going to go back to our strategic initiatives, which we hope there will be some, and we already see that today, that people are saying, yeah, congratulations, SHARP, on what you've done. And so this gets back to that aspect of what ultimately philanthropy does is goes to an institution that does good with it. And that if you demonstrate that, the likelihood that they will stay with you is greater than it's just, oh, we did that, thanks, we're moving on now. So, but yeah, it's not about giving more money. It was about, we all have donor retention problems. It was retaining the donors we have and going to them. And we had people who had just recently made a gift to COVID. They may wait again to make the next gift. But the aspect is we made sure we went out and communicated and asked. And so, you just think about that in terms of the aspect of, you're asking enough to be able to get the response that you want.
And we wanted to dig in a little bit deeper to that. So of those who said that they had made a gift, we looked at it by age. And though they represent 64% of respondents, 81% of those aged 18 to 49 reported donating to COVID-19, and 19% of the 50 plus, the 50-year-olds and above reported giving to COVID. So I think it's an important distinction because to Bill's point of stewardship, the younger generations may have a different expectation of stewardship than older donors. And if you have the data, it might be an important segmentation to look through your COVID donors by age and perhaps think about their stewardship a little bit differently. We also asked about not just any giving, but increases in giving. And we saw, again, a higher response in the younger age groups, that the 18 to 49 years olds had reported, more of them reported increasing their giving because of COVID than the others, than the 50-plus-year-olds. So though this group may not have the same capacity for current gifts, their value for lifetime giving could be significant. And that's where the retention, to Bill's point, becomes so important. And at the same time, we might just want to maintain that caution with our older donors that they may be experiencing short or even long-term changes in their status because of the pandemic and perhaps economic impacts to their situations.
And great points. Again, we typically have been, our typical asking has always been to over the age of 50, even though we have lots of people in the healthcare system that are younger than that, because we talk about the demographics and data. But here was a situation of a pandemic that touched everyone's lives. And especially if you're using social media and other electronic platforms, which we did, and we saw lots of giving through our website, through Facebook and Twitter posts that Sharp did, that reaches younger audiences. And so we saw a nice, now again, whether we can retain that, especially over time, will be a challenge for us. But we think, again, we have opportunities here that we didn't have 2 years ago, just because of what we went through in 2020. So it's taking those lessons and data and trying best to sort of plan going forward.
Of course, one of the impacts of the pandemic has been the need really to increase the use of telehealth or to launch telehealth visits with patients. And there was some concern about how that might impact our patients' sense of connection to the institution. And so we asked in this survey, another one of those new questions, if they had had a telehealth visit, how did it impact their sense of connection to the organization? So 41% said that they hadn't used telehealth with the institution they were primarily supporting. But for those who had a telehealth visit, 29% said it increased their sense of connection to their organization, and 17% said it had no impact. Only 14% said that it had decreased their sense of connection. I'll acknowledge, confess that was a little bit of a surprise to me. I didn't expect to see that kind of a response. And related to that, we also asked, again, of those who had a telehealth visit, did it increase their giving or not change their giving? And again, we saw that portion that said no telehealth visit, but 27% said with a telehealth visit, their giving increased. 20% said it didn't have an impact, and only 12% said the telehealth visit was related to their decreasing their giving. If your institution is using telehealth, is it something that you can track, like we would capture when a donor is on campus, when a donor has an appointment? Can you capture their telehealth visits as part of their relationship to your institution? And is it something to track? Now, again, this was a moment in time, a snapshot in March. So if we may not need telehealth as much, organizations may use it to supplement. We may see mental health conducted over telehealth visits still for a while. But is it something worth monitoring if you have access to that data and to see how this influences your donors' behaviors.
Great points. We have a big outpatient clinic program that had to shift to telehealth dramatically, and it's not going back to where it was. We even have some shifting in the clinics and our office usage by the physicians. Now, it's really interesting to put this, what's happening in the world today in healthcare is the aspect of the platforms being used for healthcare, and telehealth is one of those. I mean, it's as we talk about the Amazonification of healthcare and the consumer driven, and they want to have it. And of course, they had to have it during COVID because they couldn't come into the clinic. And then, but at the same time, you know what we did? We did telefundraising. We did all of that COVID fundraising virtually. We didn't have one in-person meeting during April, May, and June when we raised all that money. It was all done. You know, we had online giving, we had Zoom briefings. And the idea was you still engaged face to face, but you weren't in the same room together. Telehealth is sort of here to stay, and this has launched it. But what's really interesting, though, also, it does present you with the aspect of where you're going as an organization, the role of this, and the value proposition. We're very fortunate. We just got $1 million gift, a pledge, and it's for our medical group's telehealth, population health, and remote patient monitoring program. They were so impressed, the donor was, by what Sharp had done during COVID to provide telehealth for uninterrupted patient interaction, that they said, you guys have really figured this out. This is great. This goes back to information and knowledge and sharing this. So it's really interesting is sort of relate this now to telehealth and virtual philanthropy. And that what's going to be the combination, it's a really great point, Betsy, about some will go back. Same thing for us is that the combination of in-person, Zoom briefings, virtual, texting, different platforms. Ultimately, it's still my objective to do great moves management, whether it's in my office or it's in the device or it's in person or it's on a tour, it's with physicians, whatever it might be. And I'm going to take advantage of those platforms. So my recommendation is as you think about both your cases, your future, you think about how you structure your engagement and the most effective platforms in which to be able to do that. There's another seminar down the road, we know, Betsy, around hybrid work and all of those things, but it goes telehealth, so does telefundraising. And I think it's important to have some focus on that.
Thank you so much. A big area that I've had many conversations about is the future of fundraising events. I don't think any other fundraising channel was impacted quite as immediately or dramatically long-term as fundraising events. So we did ask in our survey prior to the pandemic, what was your likelihood of attending a fundraising event? And our respondents indicated a fairly equal distribution prior to the pandemic of regularly attending a fundraising event, occasionally attending, and really not attending fundraising events. And so again, in March, we asked what they expected of their return to fundraising events. Most, not surprisingly, perhaps were reported being unsure, which they may have a different answer now. 31% expected that they would in the future both attend in-person events and attend virtual events. And then we see an exact equal match of those who say they will only attend in-person fundraising events and those who will say they will only attend virtual events going forward. I know there's been a lot of conversation about whether there's an expectation that in-person events in the future will always have a virtual component, that invitees would be given the option of attending in person or virtually, which is a logistical challenge and expense for the institution. Certainly, and we're seeing, I think, a caution around event planning, and I have certainly heard anecdotally a mix of actions Some events are still canceled. Not that it's a fundraising event, but as an indicator, the Boston Marathon has said it will return next spring here in Boston. That's a big deal for us to know that event will be conducted in person. In a conversation with a number of healthcare, fundraising professionals just the other week, Mass General Hospital indicated that it is moving, and Mass General was, I think, one of the more conservative in their approach to events in the past year and a half. They are planning a fully in-person event in October, just sending the save the dates out now, with an expectation that they might cancel it up to the day of if they needed to. So they are both planning to move ahead fully in person and planning also have a plan if they have to pull it and how they would communicate that. So I see a lot of ambivalence around events in this moment. And that might also have a geographic, we might see a pattern within different geographies, but I'm reporting in from the Boston area, quite a mix with events.
I think we're at an inflection point here on events, which I think is a great thing. I've been around 35 years. Special events have been the bane of our existence. It's been, God, we have to do this event again. It takes 6 months to put it on, and this is all or it's a great event. We got to keep doing it, and no matter the returns, how much it costs. It's and the perception that fundraising people are party planners, and that's all we do is do events. And we play a lot of golf, and we do it with our corporate partners and sponsors. We've actually now canceled permanently several events because we think and this goes to the aspect that the fundraising people are oftentimes the ones who kind of dream up the events, not the donors, and say, gosh, I'd really love to come to get all dressed up and give you $5,000. No, they don't do that. That they would rather probably have a great interaction with the CEO and a doctor and give $5,000. And I think it's opportunity for us to, we're doing a stewardship event today. We'll finally get to go outside, but it's all about stewardship and thanking people because that's going to lead to the next gift. There's three ways you raise money. You acquire relationships, you retain them, and you grow them. If you use special events as your acquisition strategy, oftentimes you limit yourself and you get stuck in that same number of people, or you grow it by a few. We sell one more table at an event, and oftentimes you can't grow those relationships because they get stuck there as well. I think it's a great opportunity for us professionally to say, again, what are the fundraising strategies, but then what are also the moves, the stewardship, the cultivation strategies, and using events, using group dynamics, whether they're virtual or in person, whatever they might be, that to make it work. Ultimately, you're successful in big gifts because you engage effectively, oftentimes in smaller groups. And so I think it's incumbent upon us to take advantage of this to say, how do we best sort of do those three fundamental forces of fundraising? How can we acquire donor relationships like social media and other types of activities? How do we retain them through communication, stewardship, and engagement? And how do we grow them through personalization? So therefore, it might be that event, which worked fine, may not be the best strategy, and that we can phase that out. And sure, do you take an income hit for once, but you look over the long term, it could be 5 times what you had done before. So this is great information. It's right. And to see uncertainty for me is no problem, because it gives us the opening to say we think there are better strategies in which to be able to engage and solicit donors.
And in our last section here on reporting the results from our survey, we asked our respondents, as a result of the pandemic, has your interest in giving to any of these healthcare priorities changed? So I don't think yes, there was, COVID is at the top. I think that's not a surprise. And then we see these other responses to a greater interest in now understanding disease, a greater interest in public health, a greater interest in access to care. Really the only place that giving to a specific clinical area saw 11% rate of less interest. Not terribly, I'm not sure that's terribly impactful. There is a great deal of interest in learning more about these different healthcare priorities, which I think relates to another question we asked in this survey. As healthcare institutions consider offering services that relate to healthcare, perhaps in partnership with other organizations like housing, mental health, food, access to care also came out as a significant area of interest to our respondents. We also see a small number said healthcare shouldn't provide these services, and we also saw interest in substance abuse, workforce development, and transportation. These might be priority areas where you can expand, to Bill's point, your relationship with donors if this is of interest to them in supporting, or it might be opportunities for new partnerships.
If you look at go back one slide again, Betsy, look at those top five. The top five that was general, understanding disease, therefore communication, stewardship, education, public health is all about the health of the public, and hospitals are at the center of that, and healthcare organizations, skilled nursing facilities, you name it, long-term care, whatever it might be. Access to healthcare is obviously a community issue. So, and improving patient care is improving patient care across the board, even the specialties. So even those top five there really show that, again, what sort of happened in this last year is the aspect that healthcare in general has become what we hope to see a permanent priority, and having the best hospitals locally with the best people, with the best technology, with the right sort of strategy to provide access to care, to provide a platform for, getting scheduling technology, telehealth, whatever it might be. And our ability to basically, share that, Sharp, we don't talk about how much money what our goal is to raise. We talk about what Sharp is investing in. And we're investing $1 billion in the next 5 years in access, in telehealth, in people, and in capital projects. And that's that message to say, we want you to partner with us. So even if there's another pandemic, we'll again be prepared. We hope never to happen. But again, for you to value this enterprise as part of the community's infrastructure. So I think this is really valuable, what Betsy shared in this slide and the next one, about the aspect of and people's better understanding of the healthcare landscape in this country. It's very complex, very confusing. Then you throw in how it gets paid with Medicare and Medicaid and insurance and all of that, and physician relationships. It's very complex. And it affects all healthcare organizations because we're all part of that sort of dynamic. So I think the more that we can, as practitioners, understand that, work with our leaders to create cases, and even if it's not even asking for money, but educating, we will have come a long way from where we were just a couple of years ago. So it was great to participate in the study, great information. And we've again shared that and have really gleaned from that. But now also going forward, it gives us some lessons learned as well of where we need to focus on. And I'm always happy to share any of our information or data about our program in the last year or two. And we always believe in doing that. So I know we can follow up as accordingly, because you're going to take it from here, Betsy.
Yes, thank you. So Bill was kind enough to join us back to back with another meeting. So here we are at the top of the hour. Thank you, Bill, for all of your contributions to this conversation, and for your continued collegiality and all that you do for the field. We're very lucky to have you, and very grateful for your time with us today.
Thanks for allowing me to be part of it. Thanks for those who participated. Again, follow up with questions. I know there's going to be some polling and questions, should be some great information, and look forward to another opportunity to share. So,
Bill, thank you so much. So as I mentioned, we are a firm that values data greatly. It is at the core of all of our work. And so couldn't help but take advantage of the opportunity of having the participants that we do to ask you some questions and to get your data, and again, to see how this your experience might relate to compare to the results of our survey that we just went through. So I'm going to ask a series of questions and look forward to your answers. The first, are your major donors generally giving more to unrestricted funds than restricted funds? So I'll look forward, I'll appreciate your responses. We have just about 60% who answered. I'll give it just a couple more seconds. So your responses, your experience is that your donors are generally, your major donors are generally not giving more to unrestricted funds than restricted funds. That is, though that's not what we saw in the survey, that does not surprise me. I do think in healthcare, when donors are giving at the higher levels, there is a tendency to restrict the gifts. So thank you for that. Our next question, true or false, our major donors generally support other organizations outside of healthcare? Sorry, that's the wrong question. Sorry. Give me 1 second. Got it. Sorry about that. Here's the correct question. Our major donors generally support other organizations outside of healthcare. Thank you for your patience there. I'll give it a couple more seconds for you to get your answer in. So you are experiencing what we saw with the survey results, that your donors generally are supporting other organizations, and good that you know that. I think that's important that you understand how your organization relates to other philanthropic priorities that your donors have. So our next polling question. Giving decisions by our major donors tend to include at least one other family member. I'll give it just a couple more seconds. I see some answers still coming in. So I'll close that poll. And that is a rock solid, complete alignment with the results that we saw from our survey, that your major donors are including at least one other family member in their discussions of their gifts. Our fourth question, my healthcare organization raised more last year than it did the previous year. By last year, I mean to ask your COVID year. I don't want to slice and dice the fiscal years, but in the last year that was the most COVID of your years, how did that compare to your pre-COVID year is the intent of the question. So did you raise more during your COVID year than your previous non-COVID year? I see a couple more answers still coming in. So I will close this poll. And here's a split. So the majority did not experience an increase in fundraising in their what we'll call their most COVID of years as compared to their prior non-COVID year. But 43% did. So that's an interesting mix. And of course, that's the limitation of this. I have so many more questions to follow up to wanting to slice and dice and understand that distinction, what type of organization, what size of organization, what geography of the organization. But that's an interesting split for our healthcare colleagues. We raise money specifically for a COVID-19 fund or COVID-19 needs. Curious to see how many organizations raised COVID funds last year. So that was a quick run of responses. It looks like most are in. So now it gets even more curious because we saw the split of raising more money with the organizations, and now all organizations are saying they raised COVID funds, but that didn't necessarily lead to more funds raised during their most COVID year. So again, and I'm would love to slice and dice that that more. Does that mean funds were redirected for those organizations that didn't raise more? Did it mean that they were not giving to other? So a host of questions, but interesting to see that 100% of the participants in our quick poll did raise COVID funds. Another question for you. We saw a majority of our donors make larger gifts last year, meaning again, the COVID year, than the previous non-COVID year. So a majority of donors make larger gifts. I still see some answers coming in. Okay, I think we've got, everybody, we've got everybody. So here we see another kind of a split. That the majority, almost 3/4, a little over 3/4, did not see a majority. And I know it gets tripped up on majority, but majority of donors make larger gifts last year. But there are about 1/4 of those participating in our informal poll here that did see a majority of donors make larger gifts last year, which is encouraging, but also relates to the mixed results of the Giving USA data, and as well as the results that we're finding in our own poll here. Last year, we recorded more new donors than the previous year. Let's see how our participants here. If you saw more new donors than your previous year. I still see some answers coming in. Okay, I think that's everybody. I'll close this poll. And here, again, a mixed response. We see almost 60% did record new donors than the previous year. So again, those we would want to look at, were those COVID donors? We would think they might very well have been and help to contribute to some of the fundraising results last year. Let me move on to our next poll. Do you have a sense of a greater appreciation for the role of fundraising at your organization as a result of the pandemic? Do you think fundraising has a higher profile, a better appreciation at your organization now than it may have pre-pandemic? I'll give that a couple more seconds. I think that's everybody. Oops, one more just snuck in. Two more just snuck in. Thank you for your answers. So here again, we see a split, but it's encouraging to see that almost 3/4 do feel like fundraising has garnered more appreciation at their organization as a result of the pandemic. That's encouraging to see. We have a couple more questions to ask of you. Did you see more younger donors, and we're calling younger less than 50 years old, giving more last year than in previous years? Again, that would mean you have that data and you've done that analysis, but if you do and you have, we're curious to see if you've seen the same at your organization that our survey respondents reported. So it looks like, not unexpectedly, we have fewer respondents, but it looks like we've got everybody answered who can. And I appreciate that maybe not everybody has that data readily available or top of mind this afternoon. So interestingly, 40% did see more younger donors, but unlike our survey respondents from March, 60% did not see an increase in younger donors supporting their organization. You offered telehealth visits during the pandemic. Your organization, did your organization use telehealth during the pandemic? I think that's just about everybody. And it looks like the clear majority, almost everybody who answered, did use telehealth during the past year. So again, I think it'll be important if you can collect that data to look at how that may or may not impact your donors' sense of connection to your organization and or giving, and see if there's any correlation with the use of telehealth and giving. So about fundraising events, please pick one. In the next 12 months, we are planning to hold our fundraising events only in person, only virtually, all hybrid, meaning that the people will be able to attend both virtually and in person at the same event at the same time, a mix of in-person, virtual, and or hybrid, or you've canceled your events for the next 12 months. I see some responses still coming in. So thank you for those who are answering our questions. It's much appreciated. It looks like, ooh, one more. I guess that's everybody. So that's very interesting to see the clear majority are using the mix, the in-person, virtual, or hybrid. 15% of those who replied are going only in person, 4% only virtual. Nobody in our informal group here has is committed to all hybrid, but neither has any organization still canceled things for 12 months out. So I do think this will be our event future, and it does make planning can be challenging. You know, which event goes which way? Do we want donors to decide? Do we decide the costs of it? The planning? How do we allocate resources for this mixed world? What lessons have we learned from this past year that we will apply going forward? And to Bill's point, even what events will we just not even go back to? So thank you, that's very interesting. And then our very last question, what do you think will be the lasting impact of COVID-19 on your fundraising program? Fewer in-person solicitations, a hybrid office model, expansion of your digital presence, new or different performance metrics, a heightened emphasis on stewardship. We've certainly heard that from Bill. Continue board meetings virtually and expect continued consistent attendance, or something else. If you have something else to share, we'd love to hear that in the comments in your Zoom toolbar. I'll give you, I don't want to rush you. It takes a little bit longer to check multiple options, and I still see some answers coming in. So I think that's just about everybody. Thank you so much for all of your answers. Let me share our results. So the one answer that will be applicable for, are you seeing the results? Okay, I think you're seeing the results now. That most of our participants here will expect to expand their digital presence, which is I think, as we heard, I think we all became digital gift officers in a way this past year, and having digital as an additional channel for fundraising will be really important. I often tell the story. I was speaking to one colleague who was working with $1 million donor who was in his young 90s, on FaceTime. And they were going to close this $1 million deal, a $1 million gift on FaceTime. And my colleague said, I don't think I'll ever see this donor in person again. He is having so much fun on FaceTime. So I think it's important that we all do consider how we can continue to expand our digital presence, in part because that's where we're going to meet our donors, especially some of our new donors. And then coming in a close second was a heightened emphasis on stewardship. Certainly Bill made, as he always does, an eloquent case for the importance of stewardship, especially with these new donors who may have come in through COVID. And of course, our survey didn't have anything to do with the fundraiser's office model, but I couldn't help but be curious and take advantage of your presence to ask about your future office. And I do think we're seeing indications both in and out of nonprofits to see a hybrid office model. Also seeing a difference between type of institutions. I'm seeing my higher ed colleagues back in the office sooner than I'm seeing healthcare fundraising colleagues, and a mix with other types of organizations. So it will be curious to see how the hybrid office model continues. We've also heard stories of those who are not offering a hybrid office model experiencing lower morale, if not actually higher turnover, because those individuals are seeing many of their peers and colleagues enjoying a hybrid option. So it'll be interesting to see as that continues, the expectations as we continue forward and coming out of the pandemic. New or different performance metrics, I think that's also important, especially as we are working more digitally. I'm not surprised and would expect to see some metrics around engaging donors, stewarding donors, but I, of course, am curious what other new metrics. Definitely fewer in-person solicitations. That's interesting to see as an expected lasting impact. We've heard a lot about the Zoom meetings making board attendance more consistent. So I guess I'm a little surprised it's not a higher response, but I do know people are also eager to get back in person and would love to hear more in your comments. So thank you. I can't thank you enough for participating in the polling. Again, having you here is just an opportunity to collect your data and your input. So thank you very much. We have a few minutes left for questions and answers. I know one question was asked earlier in the session. I imagine a majority of organizations unrestricted funds in 2020 distributed cash to COVID initiatives. Moving forward, what is the best way to keep those new donors engaged philanthropically, keeping in mind unrestricted cash is a high priority through COVID support, though COVID support is not anymore. I know Bill contributed the ideas of communication, stewardship, sharing impact first and foremost, and then developing longer term cultivation plan and activities. Having had a time where in my career where I worked for the Red Cross, we saw this all frequently, that there was always a generous response in time of disaster. And though the Red Cross was always there in between disasters, the donors didn't necessarily continue their support. And that idea of converting a donor from a crisis to an ongoing donor is a challenge. And we've all kind of gotten into that space, those of us soliciting support for COVID relief efforts. There is something about the fact that when we had this crisis that impacted so many different types of organizations, that your donors chose your organization. So at some level, there is a connection already to you, some kind of trust, your reputation, your presence in the community, some kind of connection. To Bill's point, they may have been in his universe, but had not yet made a gift. So there, you're starting with some warmth, if you would, and that's what you need to build on. That you were the organization they trusted, and you continue to do important work. I think there is an appreciation now for the frontline healthcare worker, perhaps more than there was in the past. That's another message to convey, that those heroes are still on the front line of other healthcare issues, and that your organization is still a trusted resource. So it's about the messaging, it's about where you meet them. It's also about, again, not treating them as a monolith. In our quick review here, we saw differences just slicing the data by age. So as you have data, use that to your advantage in creating engagement strategies, stewardship strategies for these new donors. I wouldn't be honest if I said there's a way to retain all of them. Again, my experience would indicate probably not. I do think it's possible to retain a good number of them, the new donors who have come to your organization during this time, again, because they chose you when there were a lot of other choices. Unlike the Red Cross, there's usually the Red Cross or the Salvation Army show up at disaster sites. So there's something there for you to build on and to be optimistic about. So of course, I reiterate everything Bill says, but I hope that's a helpful elaboration a little bit on those possibilities. So let me ask if there were any other questions that we could discuss in our time here.
Hi, Betsy. No additional Q&A questions necessarily related to the data. There was an interesting comment in terms of the polling from an attendee. We've made a strategic decision to eliminate many of our events. The events need to be meaningful and impactful. I would say only about 20% are going to move forward in the future. It's just an interesting note if you hadn't had a chance to see that yet.
Okay, thank you. I am so grateful for your spending your time with us, sharing these results with you. We intend this to be a helpful tool, a resource, that this can be something that informs some of the decision making that you may be making now or in the future. We will, of course, return to the healthcare survey next year. We are interested in including your donors, and then, as we did with SHARP, giving you those responses back if that's of interest to you. We will be sending you the full report for within the next 24 hours. We will also make the webinar available if you have others who you think this might be helpful for. Let's see, I think, do I have any other messages here at the end?
Nope, I think we are all.
Okay.
Thank you so much, Betsy.
Thank you. Thanks to all who participated today. We're very grateful for your time.